Brachytherapy is a form of treatment where we use a live radioactive source internally in the patient's tumor to treat them. It might be used as the only type of therapy a patient gets, or as part of a bigger scope of maybe like a boost along with like external beam or chemo or surgery as kind of one of the members of the team of therapy. So here at Parkview, this is our treatment console. So when a patient's getting treated, we'll be sitting out here at the console, and you can see we have audio, visual of the patient inside the room. This is where we create the plan in our treatment planning system, send it over, and then actually treat it from this setup. So we can go inside the treatment room. So at our site, we're lucky enough to have our afterloader in a separate suite as opposed to being in the same room as an external beam. So the patients will come in here. So this is just a bed that they might be on. This is what's known as an afterloader. An afterloader actually houses our Iridium-192 source. So there's a live radioactive source in here. There's just one source. So what happens is that a patient will have an implant done, and then we connect that implant, whether it's needles or an applicator. If we pretend that this is a needle that's been inserted in the patient's tumor, so it's directly inside the patient's tumor, it's implanted there by the physician, we then connect it to our transfer guidance tube, and then this gets connected to our afterloader. So then we have a channel that goes from the afterloader right directly into the patient's treatment, into their tumor. So instead of something like external beam where we're working from the outside in, Brachy's working from the inside out. So we're able to manipulate dose where we really can avoid sensitive structures. Like, if we're doing a prostate, we can really avoid rectal and their bladder because we're going inside the prostate out. So there's lots of checks, safety checks that are done with this afterloader. During every treatment, we do a length check, and then a dummy wire comes out, does a measurement, and that's actually when the source is finally released. But there's lots of checks that happen prior to that before the actual source is allowed to come out. Like, I cannot be in the room when we're actually delivering the treatment. So we'll have the patient all hooked up, we'll do all of our tests, we survey the patient, we do a nice little survey of the patient for their background, and then I'll actually survey the afterloader. We'll do this before and after the treatment, and it's just a safety precaution to make sure that our radioactive source has gone back to its home. You can actually kind of hear it beeping a little bit. That's the survey meter detecting the source that's inside this little, it's safe inside the afterloader. So once the patient's hooked up, we are happy with all the connections, then we'll come outside the room during their treatment. Patient will stay in here. Everybody else will have to come out of the room, and then we will administer their treatment. So we have emergency procedures. We'll watch them the whole time. There are some potential little beeping noises that we let the patient know about, but all in all, very calm, very kind of a boring treatment for them, because once the implant's done, the actual treatment might take anywhere from 5 minutes to maybe up to 20 minutes. Once that treatment is completed, we'll go back into the room. We have a third-party radiation detector on the wall, and that's what we want to make sure that goes down to 0. It's only detecting background. That's how I know that it's safe to go into the room. We'll go in, and just like we surveyed before the treatment, we'll survey the patient, survey the afterloader, make sure everything is back in its home and happy. The radiation is now contained back into the afterloader, and then we'll disconnect the patient. So we would take the transfer guidance tube out, disconnect this, and then the physician will come in and remove whatever applicator is inside the patient. It's a really great form of treatment. We really can control dose. We control dose via dwell positions that are in each of the applicators. So it's either we have the source hang out longer or shorter based on where in the needle it is. And yeah, patients do really well for it. Sometimes they have multiple fractions, so they'll come back in a week, maybe get the same procedure done, and then they'll be done, and that'll be their boost, and that's brachytherapy.